Hi everyone, it's Dr. Marilea Yu. Hope you are having a wonderful day. And today, I wanted to talk a little bit about conventional labs and why I always ask my patients to bring them in if they've had labs done, like blood tests done by their medical doctor or previous practitioner. Especially if they tell me that their doctor said that everything was fine. And obviously everything is not fine because they're here in my office feeling not so fine, right? So I'll ask things like, okay, did you get your vitamin B12 checked? Did your doctor check that? Did they, or have you had your vitamin D checked? Or other markers, thyroid, etc. Those are kind of like the basic ones. And if the patient says yes and the doctor said they were fine, I'd be like, okay, well, can you bring those in if they've had them done recently? If not, I'm going to encourage my patient to run those labs again, and then some other labs as well, because there are other labs that may be associated with certain markers that I would want to look at. Like, for example, in iron deficiency, I would want to look at their complete blood count to see what their red blood cells are looking like, and so on. And if they have thyroid issues, if their symptoms look like they might have thyroid issues, I might run labs other than the TSH, the thyroid stimulating hormone. So the reason that I would want to look at these labs myself is because the numbers are found within normal limits, within reference range, doesn't necessarily correlate to being in good health, right? So there are reference range levels, and then there are optimal range levels for a number of markers that I would look into. So in a lot of cases, you kind of want to be in the middle of the reference range, not creeping towards either the low end or the high end, right? Because when we look at the way that the reference ranges were created was typically from people who weren't feeling so great, right? Because people who are not feeling so great are the most likely people who are going to be requesting blood tests or getting lab tests done. So, that range of population will tend to push the reference ranges out, either on the high end or the low end, or both. So just because you're within reference range doesn't necessarily mean that's where we want you to be, right? So that's one of the reasons that I will either order labs myself, or will have the patient bring in any labs that have been done by a previous practitioner.